Hey, Dragon Slayers. Right now, my blood sugar is 91, and that's about an hour after eating dinner. Had some duck eggs and some. I'm trying to remember what I had. What else did I eat? Because I had something a little bit before that. Oh, I had some lamb bacon. It was very good. So, today's video is all about the connection between insulin resistance and how it's often the root cause of non alcoholic fatty liver disease. So, fatty liver disease used to be something that was associated almost exclusively with alcoholics, probably about 100 years ago or so. And in recent history, I would say in the past 50 years for sure, but especially in the last 20 years, we've been seeing so many cases of fatty liver disease all over the world, but particularly in the US, that are associated even in children, like people who are clearly not drinking alcohol. It has become quite the epidemic. And so, in the description below is a research study that I linked to you guys. I will go over it in a little bit of detail and share some portions of it to show you some of those connections. Non alcoholic fatty liver disease, also known as NAFLD, is one of the most common chronic liver disorders worldwide. It is associated with clinical states such as obesity, insulin resistance, and type 2 diabetes. It covers a wide range of negative liver changes. Metabolic disorders such as lipid accumulation, so gaining fat, insulin resistance, inflammation, have been implicated in the pathogenesis of non alcoholic fatty liver disease. Both innate and recruited immune cells mediate the development of insulin resistance. Oxidative stress is also pivotal for the progression of non alcoholic fatty liver disease, which has generated interest in carotenoids as potential micronutrients and antioxidants in the treatment of non alcoholic fatty liver disease. So, oxidative stress is pretty much why we age, right? It's one of the primary markers of why we age. And so they're looking at exploring of using antioxidants to try to help treat this. So in this review, we summarize the molecular mechanisms involved in the pathogenesis of non-alcoholic fatty liver disease, including macrophage, uh, K, Kupffer cell polarization, and distributed hepatic function in non-alcoholic fatty liver disease. So hepatic function just refers to the liver. Anytime you hear hepatic, that means liver. It has been shown that non alcoholic fatty liver disease is closely associated with insulin resistance, as 70 to 80% of obese and diabetic patients have non alcoholic fatty liver disease. That's insane. A 70 to 80% correlation. Um, Obesity leads to non alcoholic fatty liver disease development through liver dysfunction. In obesity, patients with type 2 diabetes and non alcoholic fatty liver disease, hyperinsulinemia, are more severe than in patients without non alcoholic fatty liver disease. Excess fatty acids and the production of which is induced by lipogenesis and fatty acid synthesis. So, lipogenesis is just converting of fat, and fatty acid synthesis, as well as oxidated fatty acids circulating the peripheral tissues, including the liver and adipose tissues, adipose meaning fat, where they are accumulated, resulting in insulin resistance. So, the development of non alcoholic fatty liver disease or type 2 diabetes impairs fatty acid metabolism and promotes a chronic inflammatory state in the liver. So, that basically is just saying that if you have type 2 diabetes and a fatty liver, then it is going to promote chronic inflammation in the liver and make you sicker. Non alcoholic fatty liver disease has become one of the most common liver diseases worldwide. It's a complex pathogenesis and is closely associated with disorders such as obesity, type 2 diabetes, and insulin resistance. So there you have it, guys. Check it out and let me know what you think. Remember that together, you and I will slay the dreaded diabetes dragon, as well as reverse fatty liver disease.